Yeah. So why did you go to Spain?
To learn something what I could not learn here.
What is that?
First of all, exposure to facial aesthetics, mainly facelifts. So that's what I first encountered over there.
Just quickly explain
Yeah.
what is facelift.
So basically, it's like as we age, the face sags and your face deflates, or the fat goes off.
Yeah.
You start sagging. That's how you start looking older. So facelift is just reversal of that. We
Oh,
do-
nice. What makes you look older? Just tell me 5 things that makes you look older.
One is less fat in your face. Okay, that's called deflation. So the volume goes off. Second is your skin starts sagging. Okay. Third is your skin starts showing changes of aging by itself because sun damage is there.
Yes.
Then you're exposed to a lot of pollution, this, that, and all. So the skin also starts showing aging. And volume loss, bone loss is there. As you grow older, the bones become weaker, thinner. So obviously that also shows. And overall, a general tiredness kind of, it's very evident on the face as we grow older.
Wear
You don't
and
see
tear.
young children looking tired.
Yes.
So yeah, so as you grow older, definitely that starts showing more and more.
So what is the age range that this happens?
Usually we get these patients from say 35 onwards these days to say up to 55, 60, 70. Yes.
Most commonly, this procedure is taken care by 35 above, or it's like 40 above or 50 above?
They come as early as sometimes even 30s, 30, 35 and all. But that time we do something like minimally invasive or non-invasive, like fillers, Botox, little things.
Okay.
But when it comes to surgical intervention, yes, the ones above 45 and all generally do need it.
Okay, so this is overall in Spain.
Yeah, this began in Spain, but it didn't end there.
Okay.
So then I realized that yes, there are more stalwarts sitting elsewhere in, scattered across the world. So the easiest access to me, next one was Belgium. I wouldn't say easy access, frankly. I had to earn it.
Before you
Yes.
travel from Spain to Belgium, I want to understand, because this is a very curious, interesting thing. So you're saying that anybody who is above the age of 35 or 40, they'll start showing, definitely, we understand that. And these procedures like facelift and all the things like fillers and Botox, all these things, when they take these procedures, does it make them look younger, and how much younger? And who's doing this?
Yeah. So usually speaking, if it comes to the surgical aspect, only plastic surgeons should be doing it. And if it comes to something like fillers, Botox, which are non-surgicals, even dermatologists can do it. Yes.
And is this a common thing that actors do?
Very common.
Okay.
Very, very common these days. Because earlier, at least, you must have noticed, there is a natural way of aging. And people used to show that. Now, it's not like that anymore. They'll have to look young for a longer period of time. Say up to 8 to 10 years younger. I can't say that somebody from 50 can be made to look 20. But from 50, 40 is definitely possible. Yes.
And does it require a lot of care after that?
Decent amount of care. Maintenance is, of course, required. It's like you buy a Rolls Royce, you have to maintain it, right?
Yeah, but for a deadlift, you have to pick it up.
Yes.
What happens in facelift? What are you picking up?
You're picking up skin and you're picking up the soft tissue. So all of it is reposited back in the face from where it had sagged down.
How do you do that?
Surgically. So we take a cut over here, we open up, we go inside, lift up everything. And at the same time, we add, at least I do in my practice very frequently, I do fat grafting as well along with that, because it is not just that the face is sagging. It is not just the skin, it's the volume as well. We need to make your face look younger, youthful.
So what is pulling it together?
The stitches.
Okay. Yes. And it stays for a long period of
Oh
time.
yes, definitely. Because we first rely on the stitches, but then the body itself takes over, because these are dissolvable, I can say. So they go away, but then the body sticks. It lets it stick over there.
Okay. How much time?
Say up to 7-8 years. Yes, depending on what facelift.
How much time would it take for the stitch to go away?
Just about a year.
Okay.
9 months to a
And
year.
this is all under the skin, right?
Yeah, nothing is seen outside.
Nothing is seen outside.
Absolutely nothing.
Okay. And is this a set of procedures, or is this one procedure?
It's a huge set of procedures, basically. So you can pick and choose what you want and what your surgeon would recommend in you. Say, like some people have these, droopy eyelids, make them look sinister or tired, kind of. So they can be corrected. Sometimes these brows droop, so you can lift the brow up. Then at the same time, these folds become more prominent, so you can lessen these folds. The jawline area can be, tightened up. The chin, and the jawline as well. Some people, have this turkey neck issue, so even that can be fixed.
You said the fat is going away. That is making the people look older. So do you put more fat on that?
Yeah, good question. Because it's like, I'm contradicting myself. Basically, some fat goes away and most of it starts sagging. So, one, we need to lift up fat. And second, we need to add fat which has been lost. So, that's why you need facial fat graft.
So where do you take the fat from?
The tummy, usually, the lower tummy.
Okay.
Or you can even take from the thighs.
So with the facelift, you get 50% off your tummy?
No, not exactly 50.
Okay.
What we do is the procedures are different.
Okay.
Though it is called a liposuction,
Okay.
that is done with a different set of instruments.
Okay.
Because the fat has to be viable. So, very gently you take out some amount of fat. When we go for liposuction, where you want to reduce the tummy, yes, there we go, vigorous, full on.
And this whole thing can be done as a whole package procedure.
Yes.
I'm not talking about a financial package, but but someone who wants to do a whole thing, they can do that.
Yeah. So a facelift, neck lift, facial fat grafting, eyelid surgery, you want to lift up the brows, you want to add a chin implant. All of this can be done in one go.
And how much time does it take to do this procedure?
If all the works are to be done, then roughly about 6-7 hours.
That's all.
Sometimes even 8.
And
it depends what.
And how fast they can go back to their thing.
The next day. We usually keep them overnight, and the next day they can definitely go.
And does it, is there any stitches or anything visible from the next day?
Yeah, the stitches are there, but they're usually concealed very well. We do give dressings and all, so they're not visible to the layman.
Okay.
But by about day 5, all the stitches are off.
Completely off.
Completely off. There are no stitches on the outside.
And for the next 7, 8, 10 years, it's there. And it is all uplifted.
Yes.
Wow.
Yes. It depends on.
And is this common these days?
Facelifts and all, extremely common. Very, very common. Okay. People are going in for it. In fact, when I learned these procedures and I came back to India and started doing them, initially I used to, see hesitancy in people to undergo these procedures because, oh God, they're very extreme. You're going to open my face and do this and do that. But now I can see that the acceptance is rising. People are more and more coming because, one, consistency of results from plastic surgeons. The results are coming out good. They are seeing sustained results. It is not like a filler or Botox that the result will go away soon enough. So, all these positives are being highlighted and they're seen more. So, even people are, more forthcoming. Like, we want to go in for these things.
I've seen some people saying that, recently also there was an Instagram viral video going on that some people get this, dragged because of the facelift, Botox things going outside, and it is like, the swelling, all kinds of things. Is it common or is
swelling does remain for about 2-3 weeks, but then it settles down. Okay. Again, that's why we emphasize, please get all these procedures done from certified individuals who are, into it always and who keep doing these procedures again and again. Go to board certified plastic surgeons or dermatologists to do your fillers, Botox. Don't go to any random surgeon to get these procedures done. Then yes, you may land up with a lot of swelling.